Guys, this is Lily and welcome to my YouTube channel. In this video, I'm going to be discussing to you the topic about continuing education units or the CEUs. Okay? Okay, so as outlined here, we will be discussing several topics under CEUs. Just take a look at this. This will be the topics we will be discussing in this video. As an introduction, it is mandated by the Health Professions Procedural Code of 1991. The College of Massage Therapists of Ontario has developed a quality assurance as QA. It is a program to promote continuing competence and continuing quality improvements among registered massage therapists. Okay? The three elements of the quality assurance program are the self-assessment, the continuing education units, the CEUs, and the peer assessment. So in this video, we're going to be focusing on the continuing education units of the quality assurance or the QA program. Okay, what are CEUs or the continuing education units? What is the purpose of the CEU program? Okay, so CEUs are the means through which registrants demonstrate their commitment to continuing competency and continuing quality improvement. The CEU guidelines require that each massage therapist obtain a minimum of 30 CEUs during the 3-year cycle. A minimum of 20 CEUs must be from Category A, and the 10 may be from either Category A or Category B. Okay? The modalities and competencies that make up Category A CEUs are those that are related to the scope of practice of massage therapists and the core competencies of the profession. Category B CEUs are linked to the complementary modalities. Okay, the CEU submissions. Okay, the CEU cycle ends on October 31st. Up until now, registrants have been required to submit their CEUs no later than December 31st. However, beginning this year, the CEU submission date has changed to November 30th. This will still provide registrants with 30 days to submit the CEUs after completion and avoid the requirement to submit the CEUs during one of the busiest times of the year. In addition, registrants will be required to complete their CEUs online. Okay. So in what publication can CEU articles be found, and how many articles are published per CEU cycle that registrants are required to read and answer questions about? The only part of the CEU program that is not self-directed by the registrant is the completion of mandatory CEU articles found in the college newsletter Touchpoint. Okay, so during a CEU cycle, 9 articles are published that registrants are required to read and answer questions. Completion of these 9 articles allows registrants to claim 3 Category A CEUs during the CEU cycle. The mandatory CEU articles cover a range of information from new legislation that massage therapists are responsible to know about, to information on college programs or procedures, to covering topics that are relevant to practice. Okay. Okay. So there's the change in approval of courses to qualify for CEUs. Okay, so effective immediately, the college will no longer pre-approve courses as qualifying for CEU credits, as pre-approval gives the impression that CMTO is endorsing the course and that registrants based on the results of their SAT. Okay, self-assessment tool should determine what courses they need to take and if these courses relate to the sources of guidance for CEU selection listed in the previous section, sorry. Okay, so just proceed on reading, taking a look at the other statement here. So how long are CEU cycles? Okay, CEU cycles are 3 years long, beginning on November 1st after a registrant first registers with the college and ending the October 31st, 3 years later. Each cycle runs from November 1st to October 31st. During their CEU cycle, the registrants are required to participate in educational activities to obtain CEUs. The program allows for a wide variety of activities that are valid for CEU, allowing registrants to follow their own educational path within the profession of massage therapy. Okay, so there's another statement here, just read on that. What are the guidelines for CEUs? Okay, so the continuing education program consists of two components, a mandatory reading component and a continuing education unit component. The CEU guidelines outline that what activities are eligible for CEUs and which competencies or modalities the college deems applicable to the profession. Okay, so the updated guidance for CEU selection. There are many sources of guidance to assist registrants in making their CEU choices. These sources are all posted on the College of Massage Therapists of Ontario's or the CMTO's website at www.cmto.com for registrants quality assurance CEU guidelines. Okay, number 1 is self-assessment tool. 2 is CEU category A and B definitions. Number 3, CEU criteria. Number 4, approved modality and activity lists. Number 5, online CEU courses search. Number 6 is massage therapy scope of practice definition. Okay. So in addition to these sources, CMTO would like to draw registrants' attention to 2 additional sources of guidance for choosing CEU activities. Number 7, interjurisdictional practice competencies and performance indicators. Okay, so just read on to the last statement here. How do I identify CEU learning activities? Okay. So there are many activities that are allowed, such as courses, reading, and conferring with peers. Valid CEU activities must meet the following requirements. The activity must be an approved activity where learning takes place. The topic you learn about must be related to an approved competency or modality with a focus on massage therapy. The learning outcome must be related to the practice of massage therapy. What topics are valid for CEUs? Okay, according to the CEU guidelines, there are 2 types of topics that members can use for their learning, modalities, and competencies. The approved modalities are listed in the CEU guidelines for both category A and B. The approved competencies are related to those listed in self-assessment tool. CEU activities must advance the registrant's learning in either a modality or competency related to massage therapy. Accepted activities registrants can participate in to obtain CEUs. So here are a list. These are the list. The CEU guidelines list a number of accepted activities registrants can participate in to obtain CEU, and this includes attending a workshop, seminar, or course, presenting a workshop, seminar, or course, membership on committees, serving as an examiner, peer assessor, subject matter expert, or investigator, participate in conducting or collaborating in formal research. Additional submitting articles for publication, conferring with peers where the outcome is learning, reviewing books, articles, or videos, preparing time of a course being caught at an approved massage therapy school. Registrants may claim a maximum of 6 CEUs for acting as a clinical supervisor at an approved massage therapy program per CEU cycle, and approved activities do not include volunteer work, providing free massage, providing massage at charity events, language, or university courses without prior committee approval. So many of the above activities can be participated in at little or no charge to the member. Are there topics that cannot be reported as CEUs? Yes, there are a number of modalities that are considered outside of a massage therapy scope of practice. As such, a registrant cannot use the information that they learned about these modalities in their massage therapy practice. Most commonly, registrants have reported activities that included osteopathy, nutrition, homeopathy, equine massage, and personal training. Registrants cannot use these modalities in their practice, therefore, we cannot grant CEUs for them. Please refer to the policy on modalities outside of scope for a more thorough list. Why are the CEU cycles reporting ending? As a result of CMT's new approach outlined below, effective July 1st, 2018, the collection of continuing education units, CEUs, will be discontinued in preparation for the new quality assurance program. So here you go, guys. These CEU activities for registrants are discontinued by the College of Massage Therapy of Ontario. Okay? Evidence shows that collecting units or hours of education does not determine a practitioner's level of competency or abilities, at that those hours of learning do not translate into the way someone performs the job or provides care for their clients. The new Quality Assurance Program, or QAP, will allow massage therapists to determine how much and what type of learning they need to undertake to become more effective at providing safe, professional, and evidence-informed treatment to their clients that meets the requirements of the essential competencies of practice. Okay? Massage therapists will also be asked to identify their strengths areas for professional development and to form meaningful learning action plans that meet their learning objectives. CMTO, the College of Massage Therapists of Ontario, will provide resources and education to assist massage therapists in preparing their learning action plans and to understand the new quality assurance program. Okay, so in this statement, guy, the CEU as a requirement for massage therapies are already discontinued, so this is no longer applicable. This video is just to show, some information about continuing education program. What should massage therapists do with their completed CEUs? Okay, the CEUs that have been completed will still be useful in the following ways. Massage therapists can apply what they have learned from these activities into their practice. The first two quality assurance program tools, the self-assessment tool and learning action plan, will be launched later in 2018, and massage therapists will have the opportunity to try the new learning management system that will house these tools. Okay, once the new system is available for testing. Massage therapists can choose to enter their completed CEU activities into the new system as part of their learning activities. Massage therapists can reflect on learning activities already completed to help identify strengths and learning opportunities and what they would like to focus on in the next few years. This will help massage therapists identify their learning needs to complete the new quality assurance program tools. What is the purpose of the new quality assurance program, the QAP? Okay. The College of Massage Therapists of Ontario, the CMTO, is redesigning the quality assurance program, the QAP, to reflect best practices within the healthcare environment and to account for the recent changes in the massage therapy profession. The new QAP will assess competencies, will promote continuing competence and quality improvement, and incorporate standards of practice in order to better reflect the healthcare and massage therapy environment. Okay, what does the new quality assurance plan, the QAP, look like? Okay, the Regulated Health Professions Act of 1991 outlines what each college must include in QAP, the quality assurance plan. CMTO will meet these requirements in the following ways. Okay, so there is the self-assessment, just read on that. Professional development continuing education, like a learning action plan. Okay, just read on that. Mandatory education module, just read on that. Peer practice assessment. Okay, just read on that as well. All right, so these are the new quality assurance plan that is going to be designed by the CMTO. What is the self-assessment tool and what is its purpose? Okay, the self-assessment tool, the SAT, was developed to assess massage therapists in identifying the competencies of the profession of massage therapy and allow them to determine if this is a competency they are comfortable in performing. Part of the SAT is a development log. Registrants should use this tool to help focus their CEU selections, either to propel them further along the mastery of the competency or to review the competency to ensure that they can still perform safely and competently. Okay? When a registrant first joins the college, they should download the self-assessment tool from the website and use that as a guide to plan for their CEU selection for their first CEU cycle. And for registrants who have completed a CEU cycle, a SAT is sent to them in the spring following the completion of the cycle. The SAT forms part of a registrant's professional portfolio, which contains the record and proof of their continuing education units and their responses to the mandatory CEU articles. So increased access to the online self-assessment tool, the SAT. Okay, so please note that increased access to the online self-assessment tool, the SAT. Please note that access to the online SAT will now be available all year to those registrants in the first year of their CEU cycle. In the past, the online SAT was only accessible for a few months. In this way, registrants who are required to complete and submit their SAT in a particular year can complete the SAT whenever it is convenient for them. A separate email will be sent to those registrants who are in the first year of their CEU cycle, reminding them of the requirement to submit their SAT. The deadline to submit the SAT will be September 30, 2016. What is a professional portfolio? So registered massage therapists in Ontario are asked by the Quality Assurance Committee of this College of Massage Therapists of Ontario, the CMTO, to maintain a professional portfolio. This, simply put, is a place to physically collect proof of massage therapist continuing education activities while acting as a registered massage therapist, an RMT. They require 4 sections to be maintained of a minimum of each cycle 3-year term. Any other sections that are to be included are entirely up to the RMT to add. According to the CMTO.com, the 4 sections of RMT's registered massage therapist portfolio is to be divided into our completed self-assessment tool, a record of CEUs, identify the number of Category A and Category B credits obtained, and which competency or modality each CEU relates to, proof of CEUs collected including receipts, course attendance, confirmations, conference, brochures, etc. Responses to questions from the mandatory CEU articles published in the college standard. Okay, guys, there you go. A professional portfolio is more than just a requirement by the CMTO, the College of Massage Therapists of Ontario. It provides you with solid evidence that you have participated in learning. A professional portfolio is a collection of documents that represents your learning experiences and outcomes. These documents will include your reflections and answers for the mandatory CEU articles, records of CEUs you have obtained, proof of the CEU activities that you have participated in, and your personalized self-assessment tool, SAT. This portfolio is most commonly utilized during a peer assessment, but can also be requested to be sent to the CMT, usually via the Quality Assurance Committee. A professional portfolio is your responsibility to maintain, as the College of Massage Therapists of Ontario recognizes that massage therapists are self-sufficient and competent member of their profession. You are expected to self-direct the maintenance of this important portfolio and are held fully accountable for it. Okay? All right, guys. Note down on this. Okay. So you go, guys. This video is finished. I hope you have enjoyed watching, and I hope this video can help you with your study in your as a study guide in your massage therapy program. Okay, thank you for watching. I will see you again on my next video. Have a great day, guys.